Hey everyone, my name is Dr. Brent Tieri and I've been a board certified practicing chiropractor working with patients for the last 12 years. Now, as a qualified chiropractor, please note that the information in this video is really for general advice only. Please consult a qualified chiropractor or specialist for your own specific conditions or symptoms. So, today we're going to be talking about the top 3 ways in which you can spot a bad chiropractor. And the best part about knowing the top 3 ways to spot a bad chiropractor is that it will ultimately show you how to find a good chiropractor. So what's the reason for this video? Why am I trying to teach you this? Well, so our office is based in Maple Grove, Minnesota. We have a great practice here. And although we do welcome new clients to our office, I know that these videos can be watched anywhere, right? Obviously, patients in other states, other countries, they're not going to be coming into my office. So it's really less about attracting new patients directly. My goal is to educate. I want to educate you. I want to make your search for a good chiropractor easier. I want you to have an understanding of what a good and maybe even more importantly what a bad chiropractor is so that you can really protect yourself against those out there that aren't going to help you and they maybe don't have your best interest in mind. Now, you know, the reality is that in all walks of life, there are good and there are bad things. There are good and there are bad people. You can have good teachers, you can have bad teachers. We all probably remember a great teacher from our childhood, or maybe a not so good teacher from our high school or our college years. You can have a good dentist and a bad dentist. We all know what can happen when you go to a bad dentist, right? We've all probably heard the horror stories, or maybe even personally experienced a run-in with a bad dentist. A root canal gone wrong, anesthesia wearing off partway through a procedure, bad cosmetic dental work, not great or really even good experiences by any stretch of the imagination. Now, you can have good medical doctors and bad medical doctors, and of course, you can have good chiropractors and you can have bad chiropractors. So, how can you tell if the person you're seeing is good or bad? Well, that's what we're going to cover today. Now, before we get started, make sure you hit the like button, the subscribe button below, as that helps our channel and helps YouTube get you the content that you're looking for. So, number 1, a good chiropractor will take the time to get to know you. Now, it's absolutely essential that anyone who's going to treat you, they have to take the time to get to know you, to understand your pain and problems in depth, to understand how long you've been dealing with these symptoms, to explore the possible reasons why things started in the first place, to see what you've already tried in terms of treatment, and to really understand how this current state of your health is affecting your life. Now, a bad chiropractor, they're going to speed through that initial examination. They're going to skip parts of it throughout that health history. They're not going to take the time to perform necessary imaging studies, and they dive right into treatments and adjustments without a thorough understanding of the underlying problem. They're already looking to schedule you for the next visit without really understanding you or your health history or the history of your condition. Now, a good chiropractor, on the other hand, they will not treat you like someone on a production line. They'll take the time to get to know you. They will understand your complete health history. They will observe your body for any signs of previous injury or pain in any areas, and they will suggest further tests such as x-rays if they are needed. Now, number 2, they'll have a clear strategy. So once you've received your initial assessment, it's important that you understand the strategy and really the plan to help you, the patient. It's very important to understand that a bad chiropractor will have no real plan of action. They won't have a plan of attack, and they certainly won't take the time to outline treatment frequency, goals, additional therapies, and other things that you could really be doing on your own to help. A good chiropractor, they're going to clearly explain what the strategy is going forward in treating your condition. Now, I've seen this countless times in my office. In fact, I just had a new patient yesterday come into my office who was looking to change from the chiropractor she's been seeing. Now, why was she looking for a change? She had no idea what the goals were, what the plan was, what happens in terms of treatment when she starts feeling better. What can she be doing on her own to help the healing process? What does her insurance cover? There was so much gray area in her treatment that it eventually caused her to seek out a different office. So now she knows what we're trying to achieve in terms of her treatment, and she has very clear goals, very clear expectations of what to expect along the way. Now, number 3, the doctor will offer multiple treatment modalities that are within the scope of chiropractic. Now, a bad chiropractor, they often will be very limited in their knowledge and really the treatments that they have available to them. They will keep on trying the same thing without any other options. A good chiropractor will have multiple tools in their toolbox. They aren't going to be a one-club golfer. Now, when you find a good chiropractor, you're going to get someone that, number 1, shows knowledge and expertise in a number of different adjustment techniques. There's tons of different techniques out there. In my office, most neck adjustments are performed while the patient is seated, but we also have patients that are more comfortable lying down. And for others, we use only low force activator techniques for their adjustments rather than a manual manipulation. A good chiropractor will be able to adjust their strategy. A good chiropractor will show you how to stretch and build strength with exercises that will reduce injury and help to strengthen the areas your body needs help with. The adjustment should be the main focus of care in really any chiropractic office, but failure to address the soft tissues will give the patient really subpar healing and relief. And also a good chiropractor, they're going to suggest alternative treatments such as massage therapy, intersegmental traction, ice and heat therapy, and other methods that they believe can help you. And finally, that good chiropractor is someone that will only offer treatment methods within their area of specialty. A bad chiropractor is a jack of all trades and really a master of none. Just because something is good for someone doesn't mean that the chiropractor should be the one doing it. A good chiropractor, and really a great chiropractor, is going to be someone that is incredibly effective at applying their specialty. So there you have it, my top 3. And really, there's a lot of things that go into being a good chiropractor. And I want you to really benefit from working with one of the many of us out there that do know what we're doing and can do it at a very, very high level. It's been great talking to you, and I look forward to bringing some more knowledge your way in our next video.